Welcome back to your Feel Good Breakfast Show Espresso here on SABC3. Now, of course, it's January, the beginning of the year, the beginning of all new things, especially where health is concerned. We all want to eat healthier, we want to exercise more, and of course, for all the smokers out there, the most common resolution is, I want to stop smoking. Of course, not one of the easiest things to do, but for that, we have, of course, our expert pharmacist, Fransa Katz, who's going to give us some tips on how you can stop smoking in 2013. But before we get into that conversation, we've got some shocking stats, and if you're a smoker, you might want to put this in your pipe and smoke it.
We all know that smoking is bad for us, but just how bad? Here are some facts. The dangers of smoking are well documented, and it is in fact that smoking will directly kill 1 in 10 adults on the planet at a rate of almost 4 million deaths a year. Cigarettes contain up to 400 potent and harmful chemicals. It has been said that nicotine is more addictive than heroin. Around the world, someone dies from tobacco use every 8 seconds. And yet, 10 million cigarettes are sold every minute. On average, each cigarette shortens a smoker's life by around 11 minutes. Do you have any tips on how to quit? Or is quitting one of your resolutions for 2013? Share your journey on Expresso's Facebook wall.
Well, I think a very, very scary thing when you hear that smoking is actually more addictive than heroin. Unbelievable. Fransa, how are you?
I'm very well.
It's good to see you. Happy New Year. I think it's the first time that I see you this year. But let's talk about this smoking thing. I'm very shocked to hear that it's actually more addictive than heroin. But I think it's been repeated so many times. Even the boxes that carry the smokes say that it's a health risk. You know, be careful, stop smoking. Yet people don't do it. What are the health risks of smoking?
Most importantly, cardiovascular disease. That is the biggest cause of death in smokers. Cardiovascular disease, which obviously is high blood pressure, atherosclerosis, where you get the deposits in the arteries that causes narrowing, etc., etc.
Yes.
So anything related to cardiovascular disease, I would cause or would mention that as number one. Cancers, all kinds of cancers, especially lung cancer, throat cancer, mouth cancer. Then you get your chronic obstructive pulmonary diseases, which is a term we use for, we group together all the different diseases to do that has something to do with your lungs and breathing, like emphysema, things like that. Look, there are plenty things that go wrong when you do smoke, or that can go wrong. Something interesting as well for men, 30, 40-year-olds.
Yes.
Chance of erectile dysfunction increases by 50% if you're a smoker.
Wow.
So that might be a good reason to quit.
Yeah, there we go. It's a good start.
Macular degeneration of the eyes, where it's a slow process where you actually start going blind. Twice the risk if you're a smoker as to non-smokers. Fertility, there are so many health risks with smoking, because it's not just the nicotine, it's all the added chemicals that you're also putting into the body.
And of course aging as well. I saw one health program where it shows on your skin, you know, a few years later, if you were a smoker, if you weren't a smoker, just how badly it would affect you.
The nicotine actually causes the blood flow to be less to the skin. It's not as strong, the blood flow, and it also inhibits vitamin A, which is very important for your skin. So you do get more wrinkles. That's for the women to think about.
Okay, so now that we know all the scary bits, what can be done? Because I think, you know, it's the beginning of the year. Like I said, people are kind of starting their New Year's resolutions. What can people do to stop smoking?
You know, there are aids, and I'm going to mention what you can get, obviously from a pharmacy, as a pharmacist, from a medical point of view. But there's one thing that I think everybody needs to realize, that the first thing is that decision. You have to mentally, you have to decide, I want to quit. That's the most important thing, because even the tablets, there are 2 types of tablets that you can get. They're both on prescription.
Yes.
You have to go to your doctor. Your doctor has to first see whether you can take it, because it does have side effects, can have contraindications with other medication. But again, it's not a matter of, and they do work very well. I've seen many patients that have stopped smoking, because what they do is they help with the craving. But if you don't decide, even when you take those tablets, before you start, and it's usually a 3-month course that you stay on, because you've got to kick the habit as well. But before you start, you have to make a date when you're going to quit. So, and then you start the tablets. So the tablets help you with the craving and all the effects that you have for withdrawal. But if you don't make a date and say, that day I'm stopping, and you don't make that mental decision, you're not going to be successful.
So what happens when you do stop smoking? What changes can you expect to see in your body?
Interesting is that it actually starts quite soon. 7 hours after you've quit smoking, you can already see a decrease in blood pressure. Within 48 hours of quitting, you'll find that your nicotine level in the blood is like 93% less than what it was.
Wow.
Or nicotine, the metabolites
within
of nicotine has been, You'll find your breathing is easier, and interesting enough, nerve endings start regrowing because you find that your smell and your taste.
Yes, I've heard that before from people that
that's about
smoking.
24 to 48 hours.
You can actually start tasting your food
things better. Yeah. So you have immediate things that happen. You don't have to wait for benefits months down the line.
Yes.
So it's wonderful to think 7 hours after you've had the last cigarette, your blood pressure and pulse rate has dropped already.
Wow, absolutely amazing. Fransa, thank you so much for all that advice. I really appreciate it, and I think it excuses you from being a Manchester United fan. No, I'm joking. Fransa Katz, our pharmacist, giving us some very good tips on how you can stop smoking in 2013. And I think if anything, wow, all those shocking stats we gave you, cardiovascular disease, cancers, it's more addictive than heroin. Come on, you've got to do it not just for the people around you, but for yourself as well. Well, right now it's time for us to get together with the Good Hope FM crew. They've got some G-Sport going on, and I wonder what topic they're tackling today.
Goodness can be found in encouraging greatness at the Junior Runners Academy in Soweto. Pick and Pay, always there for you.